big gastric air bubble in there. She's full of just gas, but then the spine is inundated with arthritis. I said, now your spine is probably 20 years older than you actually are. And I said, here's why. I said, for some time, you probably have had the inability to absorb your nutrients. I said, you take an acid blocker, I bet, don't you? She's like, oh, 15 years.
For 15 years, yeah. Welcome to the Dr. Gil Show. This is where we talk about medical matters that matter to you. My guest today is Dr. Jeremy Maxwell. Welcome to the show, Jeremy.
Thank you. Glad to be here.
Jeremy is a doctor of chiropractic, and he's not just any chiropractor. He's my chiropractor. I have a long relationship with chiropractic. I had a really bad skiing accident when I was 18. And it really beat me up. And in retrospect, it probably gave me a little cyst in my spinal cord back then. And all the conventional doctors had were bed rest and painkiller pills. Not much to help me.
Nope.
Lingering pain. And I wish I could remember his name. It was a Jewish name in Highland Park, New Jersey, where everybody's Jewish in Highland Park, New Jersey. Maybe it was Goldstein. I'll call him Dr. Goldstein. And he put me back together with various things and whatnot. And ever since then, I've always had a very strong affection for chiropractic because it turned my life back around.
Yeah.
Do you see that all the time, Jeremy?
All the time. That's like what gets me up every day is who do I get to put my hands on and whose body do we have the opportunity to literally bring back to life. I mean, that's why I love chiropractic so much.
I love that. That's wonderful. Now, you've been in practice now, I guess, about 24 years.
Yep. Started when I was 12.
Now, we're going to be doing essentially 2 interviews today. I'm going to start out, and we're going to talk for about an hour or so about actual chiropractic manipulations. What are the things you physically do? Let's call more traditional chiropractic. And then we're going to have another talk about the complementary and additive things that you do for overall health that have really fascinated me for a while and that I've also benefited from. So we're going to first start talking about chiropractic. Chiro means hand. When something is chiral, it's either left-handed or right-handed. And practic means something like do or to work. This is work that you actually do with your hands.
Yeah.
Now, we've had a wonderful massage therapist here, Ryan, right? And he told me about these pictures in Egypt. There's a picture of somebody getting a foot rub that's like thousands of years old. So we've clearly put our hands on each other forever. Monkeys groom and touch is obviously very important.
People putting hands on their body and creating a level of health restoration has been around for centuries. I mean, Socrates talked about it, and basically the power that made the body heals the body. And so the basic premise of chiropractic is that, the body has an innate wisdom and it has the ability to create, health restoration.
And to heal.
I mean, we've had this conversation before that, we believe firmly that the body was genetically designed to express health. I mean, that's just clearly plain and simple. It wasn't designed to express disease.
Right.
And so really, when I evaluate a patient, I want to basically look at the 3 T's of chiropractic: trauma, toxins, and thoughts. Auto-suggestion.
I'm glad you had the thoughts there. Very good.
Yeah. So those 3 things, if you've had trauma, now you've interrupted, normal function and mobility of the spine that can interfere with normal nerve transmission. If you're toxic or your diet's poor, that can lead to deficiencies or toxicities, which can alter, genetic expression. And then you got mental stress. So we all know from a mental stress perspective how that can throw anybody under the bus, male or female. And so those 3 things are really what move a person out of homeostasis. I mean, ultimately, my job as the chiropractor is to locate those 3 disturbances, educate a patient about how they can get rid of them, and then over time, can we move them back into that state of homeostasis for an uninterrupted period of time? You do that, the genes already know what to do, express normal health. But if they move outside of that, then it begins to get a little tricky. If you're deficient, then a gene is only going to be able to express based on that nutrient. So adaptability is ultimately what I'm trying to do, is keep a person in that state of adaptation. And if you can't adapt, you die.
And I'll put a personal note on it. I think I came to you maybe a year and a half, 2 years ago.
Mm-hmm.
I was in a lot of pain. I was a mess. And you have really turned me around on many levels to a point now where I am getting fewer toxins. I am able to maintain from what I've learned from
Mm-hmm.
you. And we'll go into how maybe our listeners can do that.
Yeah.
And I don't need it as much, which is really nice. Because one of the complaints you hear with chiropractic, well, you go back, you feel better for a moment, then you got to keep going back. Well, I think I'm living proof that you actually do generate lasting change and lasting benefits. And I want to point that out. Now, I always do a little research for these. Roberta, this is not your high school yearbook.
Yeah, right.
I research topics before we talk about them. And tell me, apparently one of the seminal moments of chiropractic was, I believe, back in 1925, a Dr. Palmer, there was a janitor who was deaf, or mostly deaf, and they had something wrong with his neck, and he popped his neck back in, and apparently the deafness was cured or vastly improved. Can you tell me a little bit more about that? That's like something in the Old Testament, one of these magic moments that kind of changed the trajectory of the world.
If memory serves me correctly, it would have been probably more around 1895. It
was not even. In fact, I saw 95. I thought I miswrote it. Yes, it was September 1895. That's where the 95.
That was with D.D. Palmer. So
D.D.
He was basically the guy that's the founder of chiropractic. And again, I'm not a huge history buff on all this. I learned all this last century. But yeah, he was a janitor working for D.D. Had a complaint of a sore spot. And he had hearing before, and over time had lost that hearing. And then what happened, the big debate is, did he get an upper cervical correction? Was it like a T1, T2, thoracic, mobilization? Either way, they removed an interference, and with time, he got his hearing back for a period of time. Now, ultimately, if I've read the history right, I think he lost his hearing again. But Dee was like, okay, we're on to something. If we find some level of stress that's interfering with, brain-body nerve transmission.
Sure.
For, I think it was Harvey Lillard, I believe was his name.
Okay.
That was his main source of interference that, this book right here is what can kind of walk us through the potential neurology behind that. When you look at the brainstem, how the C1, C2, kind of protects that area. You've got all those cranial nerves and their beds inside of there. So, one of the reasons I got into the specific upper cervical corrections, where there's no twisting or cracking, there's no manipulation.
Yeah,
it's very precise to having more of that like tonal influence on the brainstem. Like today was a great example. I go to Fayette once a month and still work on clients from when I practiced up there. Lady come in, she was early 60s, never been adjusted before, which those are my favorite. They've never experienced what I call the Great Awakening, because if you really take the deep dive into the neurology of the brainstem, if you have irritation there and you look at like chronic fatigue syndrome, any kind of sympathetic type influence on the body, you're going to be in this brain fog. You're going to have abnormal, global tone. So when I'm using these babies, I'm checking range of motion. I'm looking at postural distortions. I do a global scan to kind of touch their skin, feel their IT bands.
A scan with your hands. For those that are just listening in, I'm going to flush this out. Explain. When he said these babies, he was pointing to his hands.
Yeah, so I like to use these as my diagnostic ways of feeling tone. That's the best way I can explain how the brainstem really communicates kind of globally over the body.
So after years of experience, someone like you can put the hands on and feel tone in their body and locate where these problems
Yeah,
lie.
there'll be tonal differences where they'll be kind of tight, some will be a little flaccid. So in this case, this lady came in, she was just, I don't know, maybe 3 or 4 months post knee replacement.
Okay.
Brought in her x-rays, just arthritic like crazy, big gastric air bubbles in her stomach and in her digestive system. So I'm like, all these clues are coming in. I was like, oh man, this girl, her world is going to get rocked.
And she's 3 months after a big surgery.
Yeah.
They've given her antibiotics. She's been immobile, foreign
numbness
body,
and tingling all in the legs. And you could tell she was a little nervous. She was a little jittery in her voice. I said, hey, you're in good hands. Today is literally going to be life-changing for you. And so I went down her IT band on that right side.
That's the lateral, outside of the thigh, from the hip bone.
Yeah. And she was just, oh, that's so
on the surgery side?
Yep.
On the
left side, she's like, why is that? She's like, I feel nothing on this left side, but the right side just burns and it's so sensitive. And I said, well, just remember that feeling because I'm going to come back to that once we make the correction. So I went up to her neck, checked her range of motion. She was very limited to her right. And she was like, wow, that really bothers me. I notice that when I'm driving, I can't look over to the right. I said, well, that's where that main interference is around the brainstem. And that's part of why you feel that tenderness down here. So I'm going to show you the connection between the upper cervical and the downstream. Because your case was very similar to that. We'll get to that.
By the way, you can talk about me freely. I give you permission.
So I laid her on her side. Again, there's no twist or crack to this adjustment. And so I went to C2.
It's the second vertebrae in the upper neck in this cervical or neck spine.
My little table has a little, like a 1/2 inch drop. So it like pops up and it just helps make the correction go a lot easier. I made the adjustment. I rolled her to her back, went immediately down to, like, I checked the legs for leg length and she was about a 1/2 inch short on the left. That leveled out. Went to that right leg and just ran my fingers right down the side of her leg. She literally almost started crying.
Because
she was like, there's no pain there. She's like, literally, there is no pain right now.
Right there. Like, then and there.
Instantly.
You had instant feedback.
So if anybody's ever wondered how fast the transmission of a nerve is, like you unlock the brainstem and it's like instant, So that was really cool. You could just see, her body come to life. But then I started to dig because as I'm looking at her on the table, I'm like, man, this lady is like really yellow looking, I was like, have you had any labs or anything lately? And she said, well, I just had the surgery. I said, well, tell me a little bit about, your labs. I'm like, what, do you have high triglycerides? Oh, they're terrible. I was like, okay, so we got some fatty
why didn't you guess that immediately?
And I said, well, let me ask you this. I said, do you recall seeing, high levels of bilirubin? She's like, I totally do. I'm like, all right, fatty liver, you're not breaking that down. I'm like, she's like,
you're yellow.
I'm like, you're yellow.
Right.
I'm like, I think we need to evaluate some more of this. And so then I tied into the fact that, here's your stomach. There's this big gastric air bubble in there. It's just full of just gas, but then the spine is inundated with arthritis. I said, now, your spine is probably 20 years older than you actually are. And I said, here's why. I said, for some time, you probably have had the inability to absorb your nutrients. I said, you take an acid blocker, I bet, don't you? She's like, oh, 15 years.
For 15 years, yeah.
I was like, this is why your spine is 20 years older than you are. I said, because if you can't produce acid, then you can't break down your proteins to amino acids and neurotransmitters. You have no ability to have tissue regeneration. And guess what? The body's very smart. It knows how to adapt. Where do you think you're going to get your minerals and sustenance?
Your bones.
Steal it from your bones.
And I'm going to want to go into this deeper in our second half. But I think you're showing right now how this is an artificial distinction, that like mind and body and gut, as if these were separate things.
Yeah.
So acknowledging the error of my ways, I'm going to steer you towards the actual manipulation of how you diagnose. Now, once again, for those at home that are just listening, Jeremy brought him a book by a Dr. Kirk Erickson, Eriksen, called Upper Cervical Subluxation Complex. Good-looking book here, and if you found it interesting and valuable, so might our audience. So let's come back to person comes in your office, and we call it a complaint. Okay, in the medical world, I'm not complaining, but you're not complaining. But
can I back up just for a second?
Please.
So let's set this up a little bit so people understand how I kind of came to why I use the technique that I use to give an adjustment, because I was in ninth try. So I'm almost done with chiropractic school. There was 10 trimesters. So 3 1/3 years of school that I had up in Davenport, Iowa. And so I'm sitting here thinking, okay, I'm almost getting ready to graduate. What is this going to look like? How am I going to start to put these adjusting techniques I've learned into practice? And one of the common complaints that I hear, in practice, and what we were being taught was that, when you evaluated a patient, you kind of brought them in 3 times a week for 6 weeks, 6 months, and then they somehow graduate to only 2 times a week, and then they come down to once a week. Like, that didn't make any sense to me. When you look at the principles of what makes me do what I do as a chiropractor, and if I'm thinking, okay, the human body has an innate intelligence, it's self-regulating, it knows how to regenerate. If I remove this spinal misalignment that's creating interference to this innate intelligence brain-body connection, like, how much healing can happen if I'm having to literally manipulate the spine 3 times a week for six months?
Right.
Or whatever they decide to do. Like, that whole concept didn't make any sense to me. And so I started to look a little bit deeper into BJ Palmer, who was the son of Dee Dee.
Okay.
He started to develop what they called the HIO, or the hole-in-one technique. So he only focused on C1, C2 adjustments.
Yeah, I heard about that. The axis. Some people were really focused on just that one area.
So he has books of stories of how he used to work on the people in this asylum. Like, people with serious mental conditions would, and they had a whole lab similar to kind of what we do, where they're doing blood work. They had MDs, they're checking blood pre and post adjustment. Excuse me. And so I had some guys in my class whose dad practiced upper cervical Blair. And I was like, that's close to BJ and what he was doing, and people were miraculously having these unbelievable recoveries, and they were holding. See, I was more interested in
durable
holding a correction. That made sense. Like, if you could remove interference and then sustain that for a month, 2 months, 3 months, that makes more sense to me, how you go from a pathophysiological state and move back to homeostasis.
Yeah.
All right. So that was my journey. Ninth try, I went to my first Blair seminar, and it was like, boom, my eyes were wide open, and all of a sudden, like, I personally could never adjust the same way again. Like, I could never give a rotary brake adjustment, because I understood the anatomy so much different. So the doctor that I interned with said, you practice your craft and go at it. So long story short, I had a mentor for the first 2 years of practice, Dr. Roger Morrison out of Overland Park, Kansas, taught me everything I know about upper cervical Blair. And so for my first 2 years, all I did was adjust C1 and C2.
Did you call it Blair?
Blair, yep, Blair, Dr. William G. Blair.
Oh, so it's his name, named after him. Okay.
So he took BJ Palmer's work and went in a little bit more detail on 3-dimensional X-ray. So he used to shoot 3D X-rays. Now, technology is so cool, they do CBCTs, which those are ridiculously cool.
A type of CAT scan?
Yeah. Like the ones that the dentists are using now to do scans. Now they use them for upper cervical.
Oh, that's
because
brilliant.
We used to take, when I was doing those 3D X-rays, it was nothing for me to shoot 14 X-rays.
Right.
Because we do an extensive base posterior view. We turn them, get certain, down the line of the occipital lantal joints. So, like, it was very precise to seeing how that upper cervical misaligned, and we would base the correction on those numbers. I take measurements. So that's kind of morphed over years now. That's like I see in 3D, literally.
Yeah. I do the same thing with sonograms of reproductive organs. So is the number one complaint, Jeremy, that gets people in your office back pain?
Yeah, I mean, for sure. Some level of pain, whether it's neck pain, back pain, middle back pain, a shoulder. I mean, we're conditioned to finally do something out of desperation.
Right. Pain is a great motivator.
Yeah.
So let's say one of our listeners goes to a competent, well-trained, well-meaning chiropractor in the United States.
Yep.
They're going to sit down with you. They're obviously going to chat with you a little bit, put their hands on you probably. Now, what is the role of X-rays? Almost everybody gets some X-rays, which to me, make a lot of sense. I mean, you don't want to be manipulating a tumor or a fracture or a barbed. So almost everybody's going to get some type of X-rays, right? What kind of X-rays would your average, I don't want to say,
if you
I
go
hate
into
the word average.
any competent chiropractic office,
Okay.
you're going to get at a minimum, probably a 3-view cervical. You're going to front, side, and
Of the neck.
an open mouth just to view the upper neck.
Okay. And with the open mouth, that allows you to see that top, that axis,
C1,
that
C2,
C1 up right underneath your spine. Okay.
And if people were in a car accident, a lot of times they may get some flexion extension views. They may get some oblique views, so you can kind of see, if the nerve openings are good, if there's any kind of bone spurs. Typically, they'll probably do a thoracic, front and side view, and lumbar, front and side.
Okay, so that's what cervical. When we say cervical, we mean neck area. Yep. Thoracic is kind of the chest area, and lumbar is kind of the lower back. Those are arbitrary divisions of the spine. So we'll get some.
And like you said, the main reason for that, number one, let's rule out any kind of reason we can't give an adjustment. And then the second reason is, okay, depending on your technique, you're gonna, do some type of analysis where, you're gonna make an assessment of where you're gonna make an adjustment.
Okay.
There are techniques where they'll adjust, full spine. You might get an adjustment in your pelvis, sacrum, lumbar, thoracic, neck. Some will be a little more specific. And if you look at the layout of our nerve system, we have a parasympathetic and a sympathetic system. And if you look, upper cervically and lower in the spine and the sacrum, that's your kind of parasympathetic influence. And then basically from C3 to, L5, that's more your sympathetic influence. So a lot of techniques, they may not want to mix systems. So you don't want to give an upper cervical correction that's going to have probably more of a parasympathetic influence. Case in point, that's why like when I work on infants, they almost instantly poop their diapers. It's like that vagal
because you've stimulated the
response.
Parasympathetic. It's called rest and digest, and that includes pooping.
Yep. So, when mamas are complaining about their babies being constipated, I'm like, let's go, bring them in. Coming out of the birth canal is not an easy thing.
I'll be darned here. You can work on anyone in their entire life. From
I always say
birth
from
to
the
death.
womb to the tomb.
From the womb
if
to
you
the
can get
tomb.
in my office.
Well, that was worth the price of admission, just learning that. So you can help colicky.
Oh,
I'll be darned.
I have been able to work on more colicky babies. One of my favorite stories in that, he was about 5 years old, never been adjusted. Mom came in and said, we give up. He's been on 5 rounds of antibiotics. They came in for his ears, because he's like, we are so sick of the ear infections. We're on our 5th round of antibiotics.
His whole body, And
I was just like, oh, geez. So anyways, so we got him adjusted. And, when you remove tension up there, the muscles relax, you got lymphatic flow. That's going to influence your eustachian tube.
Does it drain better?
Oh, I've seen ears drain out. I've seen them
because they put these tubes through the ear. When you get tubes, Jeremy, you're putting a hole in your eardrum. So you're trying to get that stuff out when it should go its natural way.
Yeah. So remind me of that because I got another story on that.
I will write it here.
So this young gentleman, excuse me, came in for his ears, and I was like, all right, I've watched already multiple kids get adjusted, never have ear infections again. And so I adjusted him. He rolls over to his side, and I kid you not, like within seconds, he's like, huh? I was like, oh.
Pass gas.
Yeah, just totally passes gas right there. I looked at the mom. I was like, okay, what did you not tell me about his history? She's like, oh, well, he's been constipated since he was born. I said, well, probably not anymore.
Not anymore.
I said, by the time you check out, he's probably going to be asking you for the bathroom. And sure enough, he was up there like, gotta go.
Gotta go.
She came in 2 days later, brought him back in, and she said, I had no idea that a 5-year-old could poop like that. I said, well,
yeah.
Been in there for 5 years virtually.
Right.
So he kind of got 2 for 1. But that was fun. But I had 2 boys. This was probably about 5 years ago, and I've had multiple stories like this. But this is where I want parents to really just pay attention to this.
All right, parents, pay attention.
And this goes into why one, chiropractic is not, it's not an alternative to medicine. We are
Right.
two separate and distinct things. And we use this analogy a lot with the fireman and the carpenter. So we often will refer to the medical field as the fire department. And me being a chiropractor, I'm more like a carpenter.
I love it. I understand exactly what that means. That's a great analogy.
So most people wait till their house is on fire.
Yes.
Okay, well, if your house is on fire, who do you call?
The
Call
fire.
911, call the fire department, because they have the right tools and the right education to put out that fire as quickly as possible and save the house.
And then they leave you a smoldering mess.
And then they leave me a smoldering mess. That's right. So did the medical field save that person's life? Absolutely. You know, they have the right tools and the right education to put that fire out.
Right.
Now, where people have gotten screwed up over the years is then they go back to the fire department and then they want them to rebuild it. But nobody does. Nobody calls the fire department and says, hey, can you come rebuild my basement? They call a carpenter.
Yeah,
So
my
I come
skiing
in-
injury is the perfect example.
Yeah.
I needed a carpenter at that point.
So we come in and make an assessment, and then we're going to build a plan back to health restoration. So I'm not replacing what the medical field does.
Different things, isn't
They're
it?
two different things. So we need both.
We need
You know,
both.
Don't call me if you're having a heart attack. You don't want me splitting you wide open.
Yeah,
trying
and they
to
were
save your life.
worthless when I had my chronic back pain. I got out of the emergency room.
Yeah. So that being said, again, families, you know, they think my kid is sick, they're getting ear infections, they must have to have another antibiotic. Well,
And another ear tube.
and now it's just, they know, I mean, we have so much research now on the gut microbiome. I mean, one round sets you back 2 years minimum. And that's
Yeah.
if you're intentional about it. But
Right.
this family had 2 boys, been through all the antibiotics, $15,000 in tubes.
Yeah, because they spit out. They come
They
out.
kept falling out. And they came into us. We got them evaluated. I gave these boys a couple of adjustments over the course of maybe 6 to 8 weeks.
Uh-huh.
Never had ear infections again. Probably in that time frame didn't even spend $1,000 between the 2 of them.
Right.
So it's like you want to spend $15,000 on antibiotics,
Oh, yeah.
interfering with normal function. Now you've punctured the eardrum versus removing interference.
Right.
Allow the body's innate intelligence to do what it was supposed to do. You know, and it's interesting, you know, I've been in practice 24 years, and all those kids I worked on in the early 2000s,
Uh-huh. They have kids now.
well, yeah, some of them starting to have kids now, but most of them got better with only adjustments. Now, over the last 5 to 10 years, what I've started to notice is I haven't changed how I adjust kids. I haven't changed how I adjust adults.
Okay.
But they don't recover like they used to.
Now we're going to get into this, John. I'm going to force you into
that's right.
manual manipulation, and we're going to talk about that in the second half.
Yep.
These overall things and the gut biome. Oh, I can't wait to talk about that.
Yeah. So let's
Let's
get into
go back
adjusting.
to somebody comes into you with back pain,
Mhm.
and although you're thinking in your mind other health issues,
Mhm.
maybe some other chiropractors or someone who's going to be, let's say, very strict down the middle, just doing manipulations and whatnot. So
Well,
what?
that's how we started with you. So you
Right.
came in with, I think it was left, like searing SI pain.
Yeah. My left lower back has a knife in it.
And as most people come in, they're
As
you
it
know
were.
they're going to be like, oh well, this guy is going to go right to
Gonna
the
work
spot
there,
and just kind
yeah.
of like adjust it. And of course, I threw you a little curveball, and I said, well, we're just going to work on your neck.
We're gonna my neck and say, oh.
But you know, you having obviously a medical background, I could explain the anatomy to you and go, here, let's walk through this. You know, let me show you how a misalignment to the upper neck at that C1 alters tone. And then I think why most people feel pain in the SI joint first is because you have less movable parts down there.
Yeah, the SI joint is the sacrum, the very base of the spine. It's kind of a triangle bone, and
Yep.
it sits into a V notch, and essentially in your pelvis. And it's an interesting joint. It's kind of fibrous, right? It doesn't
Yep.
move in the traditional sense, but it moves.
Right. It does have some
Right.
mobility there. And so when you look at the anatomy of the pelvis, you know, your lat muscle originates down there on the back portion and comes up into the shoulder. So when the neck is out, you've got, you know, 6 other bones that can create some adaptive mobility.
Right.
Now, if that upper cervical has kind of locked up the lumbar, because it's when I'll put my little leveler on the top of the pelvis to see if there's imbalance. There's
Okay.
usually imbalance.
So these are some of the tools of the
these are some of
trade.
the
A
tools
level
that
you can evaluate
Yep.
symmetry inside. Okay.
And so, obviously we found a short leg. I looked at some postural distortions there. But now that that pelvis is locked up, there's not a lot of mobility in the lumbar spine. I mean, it's not designed for the amount of mobility like the neck. So I think that that's why most people will feel that pain in the SI first, even though that's not where the problem is per se.
Gotcha.
Because you felt day one, you were probably an 8 or a 9 out of 10 on the pain scale. We adjusted, I think, C2 on the right, rechecked, and you were instantly, he was wanting to check this thing out and bend over and try it right away.
It was seriously affecting my ability to do surgery. That is my livelihood, part of my livelihood.
Yep. So that was pretty cool. Just that day, making a correction to the upper neck, having that influence on your SI. Now, as time went on, I always refer to it as kind of we're peeling an onion.
Yes, I love that.
Layers and layers of injury, surgery positions, all of this stuff. Your body's tried to adapt over time to keep you mobile, but then it starts to change how the structure and function of the body should work. Things that should be mobile now became stable and vice versa. And so we just began to work our way down the spine. I remember the first time we got that lower thoracic to release, and it was just like, again, boom, next phase of mobility for you. The sciatic was starting to go away, But what I really want people to understand is being pain-free with a chiropractic adjustment is basically a side effect. Really, all I did was just remove places of interference, because if people only base the need for using chiropractic care for pain, you're missing out on
so many things.
Because I've had people that have come in that don't have pain, but they just have digestive complaints. I've had people come in with migraines. They don't have neck pain or back pain. I've literally watched, young adults come in mentally just gone. Like you can just tell nobody's home. That was one of my favorite stories. That a kid just recently come in. And I started working on him 14 years ago. He was 17 years old. Came in he looked like he was just hopped up on whatever drugs you could imagine. Just deadpan face, no emotion. He had a syrinx in his brainstem. And grandma and mom were just kind of on their last, we don't know what to do.
Right.
The doctors just keep giving him depression medications, and he's not.
He's
not depressed, just like something's wrong. And so I did my evaluation again, upper cervically. That's all I did was one adjustment that one day, and it was like literally the shutters came up. He went from this pale look, just nobody's home, gave the adjustment, and he just like literally stood up and he was like, "What did you just do?"
The fog lifted.
Exactly.
The blinds went up.
It was like those Claritin commercials.
Right. Yeah. It's
you take the drug and it's like, hey, everything's colorful. I'm like, no, we're just going to remove some brainstem pressure. And literally that activated, this is where it's like you think about the reticular activating system. You think about all the cranial nerves, all the vascular influence that by just removing that little interference there can have literal life-changing experience for a person.
Now, if we look at I don't want to say types of chiropractors, but there's been a lot of different philosophies, and there's always thought leaders, and someone has a school, and you're going to do a Palmer type or a Blair or whatnot. I believe earlier on there were what we call straight chiropractors that look just at the spine. They kind of had some tunnel vision. And then there were what I believe were called the mixers. They look at spine and physical therapy and all this.
You've been doing your homework.
Yes. And I think I can say that you're a mixer. You'll take good stuff wherever you find it.
Well, that's funny that you did all that research on that because when I started practice, I was doing straight chiropractic. I was only adjusting the spine. only adjusting upper cervical, and then that morphed into me working on full spine, doing a lot of extremity work. I was working on shoulders.
Yeah, you
elbows,
do some
wrists.
of that too.
And then as time went on, I started to realize, you know what, something's missing. Because
Right.
by my protocols, I'd get people adjusted. They were lasting, they're holding. I'm like, but they're still having some problems. I've removed this interference. Why is sickness and disease still in their body? So fast forward to 2017, I started to realize I can't move forward with the model in which I'm practicing. I've got 4 kids. I'm thinking colleges, there's got to be more to what I can offer to the patients. And so that's where I came across the wellness way.
Okay, we're going to get to that in our second half. Right. I'm going to force you to finish through on the traditional chiropractic here. So most people that go to a chiropractor, good, well-meaning, well-trained chiropractor, and they're going to do adjustments. Yep. Right? Treating what you at least used to call subluxations. Mm-hmm. Let's call them where things are out of line.
Yeah. All right, keeps it simple.
Keeps it simple. And you go to a chiropractor, usually they're going to twist your hips over the Sims position. They're going to put their hand on you. They're going to push on you. They're going to pop all your vertebrae. And I used to think that's how I knew I was getting good value. If my chiropractor could pop every facet in my spine, I'd walk out there. Yeah, I got my money's worth by popping. So what's going on when your average competent chiropractor is popping all these joints? What's going on, Jeremy?
Most of them that base their care on principles of chiropractic and the technique, there should be a very precise analysis, and then they're going to follow a protocol as to how and where they're going to adjust. Now, unfortunately,
so you don't do every joint every time.
You should not be getting every joint adjusted every time. Like that doesn't even follow the core principles of chiropractic. If you really go back to the history of subluxation, it's, there was instrumentation that was used. So they had these neurocalligraphs that they would use that would measure temperature on either side of the spine and had this little dial that go back and forth. Now, technology, they use paraspinal thermography.
Really? You can admit.
I used to have a machine where I would scan the spine and you'd look for hot spots, cold spots.
Really?
It would develop like a pattern. So there was, a science behind where and why you should adjust. So, BJ was huge into this. It was like pick the major, adjust it, and leave it alone. So, for me, I picked 1 or 2 in the beginning. I adjusted it, left it alone, and people had miraculous good changes. Something more like a Gonstead technique where you're going to feel the adjustment more. You're going to hear those cavitations or pops.
Okay.
They're still very specific and they're adjusting. They're going to have an analysis of the neck, thoracic, lumbar, pelvis, and they're going to, probably adjust 2 to 3 things, sometimes maybe only 1. So a good chiropractor that's giving a good analysis, you're going to be able to feel like, yes, they're analyzing me and they're taking great detail and giving a good correction, and they're really trying to help you hold that correction. So
it's not a one-size-fits-all. It's not more pops the better.
Yeah. I mean, think about it with what you do in surgery.
Oh, yeah, right. Yeah.
Precision
just cut it.
Right.
It's everything.
And it's funny to me, unfortunately, again, just like in any profession, you've got individuals that just kind of make it crappy for you.
What do they call the person who graduates last from medical school, Jeremy?
Medical doctor.
Doctor.
Yeah. Yep. So, we all have them in our profession.
Sure.
And it's just, unfortunately, many individuals have been conditioned to think like, just a chiropractor, just go in. Like, what do you need to evaluate me for? Just crack me. And I think, who goes into the surgeon and says, Doc, do you really need to have this MRI? Do you really need to have this ultrasound before you open me up?
Right.
Well, of course they do. Like, how do you expect to get a consistent, repeatable result? Well, you have principles and you have step-by-step process that you should be taking a person through all the time.
So here we are back to the competent chiropractor someone's going to. We can't judge them by the number of pops. We should judge them by the precision, perhaps, and obviously by results. Now, it feels good just to have hands put on you.
Mm-hmm.
And I still get massage therapy, and there's always been laying on of hands and whatnot. But clearly, when you establish a range of motion, when someone is frozen up,
Mm-hmm.
and it finally starts moving again. I think the Chinese talk about meridians and energy, which is the qi, and which is almost as good an explanation as any for these things being opened up. So if a chiropractor finds problems, adjusts you, establishes mobility, establishes proper posture, functionality, the carpenter is creating.
And then there should be some follow-up assessments.
Yeah, this is not a one and done.
It's not a one and done.
It's almost never a one and done.
And I, personally, I've never practiced in a way where like we bundle like these huge amounts of adjustment visits. Like you're going to need, to be adjusted 60 times in 1 year. I mean, that's where I feel like we've gotten a bad rap, is because people are trying to sell individuals on, well, if you get this many adjustments in the course of a year, it's like I can train your back to stay in place. And I'm like, but that, again, actually defies the very principles of what chiropractic is about. Innate intelligence, like we're an educated brain.
Right.
My influence into the spine is going to be, okay, remove interference and just leave it alone. Like sometimes BJ was like, I'm just going to unlock this. The body will know how to replace it. I mean, if you look at the facets of the C1, C2, those two joints are like nothing else in the entire body. They have mirror image of the facets, versus like you look at C2, C3, C4 on down, you've got facets on each side. They move anterior and posterior.
Okay.
But you look at C1, and in regards to occiput, well, it can move anterior and superior. It can move a little bit to the right, to the left. So there's these coupling movements that are really not like any other place.
It's a unique joint.
And so it's a very unique joint, specifically to provide tons of mobility. But not only that, a ridiculous amount of proprioceptors and mechanoreceptors. And so, back to, competent chiropractic, I mean, there should be, some repeat follow-ups. Let's check range of motion. Like there should be progress.
Right.
I mean, and this is stuff that I hear that drives me nuts. And I'm not trying to poo-poo my own profession. It's just I want
an honest. I want you to give us your opinion on this.
If you're 2 months, 3 months, 4 months into care, and you're just like, you know what, I don't really feel any different. Well, guess what? You're probably not gonna change going forward. More adjustments isn't going to all of a sudden magically change that. But what I hear is that many will go, oh, well, you weren't compliant. You should have been coming 3 times a week, and you've only been coming 2 times a week. Like my own personal protocol is if you haven't noticed some change in a positive thing in the first 3 to 5 visits, like I'm already like I'm on to plan B, C, D, and E. Because even though I know it's not all about pain relief, but I should still, in my own protocol, see, did their legs change? Did we get a better postural change? Did that my hip leveler level out or not?
Correct.
Is there improved range of motion? If you can't see those things change within the first couple of visits, there needs to be some further evaluation.
So in your world, you follow progress, you have objective, as if there were something truly objective and truly subjective in this world. That's an artificial distinction, but you've got metrics that you can measure that evaluate progress, and it's not one size fits all. And I assume you have a custom treatment plan for every patient.
Yeah. I mean, that's kind of what we've built our reputation on, is we try to make it very customizable to the patient. And certainly over the course of 24 years, as we get into part 2, I'm going to dive in a little deeper.
We're going to get to there.
Massively changed.
So let's, once again, focusing on the actual physical things. So what do you use as adjuncts or supplements or add-ons to your hand? I remember my chiropractor, you had this I think it's called a TENS unit. This is a vibrating electric. He put a gel on me and was able to hit the various muscles and whatnot. Frequently, I believe you work with physical therapists, massage therapists,
I mean, directly in my office.
stretching. Tell me more.
Yeah, I mean, in my office, I've never really been a big therapeutic, adjunctive, I've never been into TENS units. I don't have electric muscle stimulation.
You don't?
I don't do any kind of soft tissue. I do some soft tissue in my office, but I usually refer out to massage therapists for that.
Okay.
I have some basic movement analysis that I do, and I direct people to follow some exercises. I went through some of Gray Cook's work with selective functional movement assessment, which I absolutely love. It's just my office isn't really equipped to really go in detail for patients to look at their functional movement, because you can think of it like a computer. If you're in pain, your body's going to change how it's going to move, because it says, hey, we still have to ambulate and move, walk,
Right.
but we can't use the original pattern you learned.
Because you're guarding it.
Yep, so you have a default pattern now.
Ah.
So Gray Cook, with his functional movement assessment and selective functional movement assessment, helps you determine, does a person have a mobility issue? So then we can find out, do they actually need an adjustment? Then what's the deal with their stability? Because if you lack stability, then you can't, build strength and power.
Oh, that of course, stability.
So
I didn't even think of that.
What do people complain about the most? Stiffness. And what have they all been told by every PT, every massage therapist, and probably every chiropractor? If you're stiff, then you need to do what? You need to stretch more. You got tight hamstrings.
Right, tight hammies, yeah.
That's not true. Most tightness and stiffness that people experience is, if it's no longer a mobility issue, so they've been adjusted and they still have stiffness, it's a stability issue. So now if you look at the pattern of movement, so from the feet up, it should be, basically stable or mobile foot, stable ankle, or maybe it's a mobile ankle. So it alternates. Stable, mobile, stable, mobile, stable, mobile. Okay? Now, say you have an injury. Most people roll an ankle. What does the ankle do? Well, it's going to tighten up, create scar tissue. Now what should be mobile is now becoming stable. There's a short circuit. So if you don't retrain the proprioceptors, you don't create the mobility and regain stability in there, now the knee becomes too mobile, because now the body's going to stay in these alternating patterns. And what does everybody want to do? They want to go freaking CrossFit, and I got to retrain all this stuff in the most challenging posture, weight bearing. So see, Gray Cook showed people that if you have short circuitry, and let's say you've fixed mobility, in order to gain maximum stability, you got to learn new motor patterns. You got to get rid of the virus that's in the body and that default motor pattern. So you have to literally start to train people how to move again in the most primitive positions. And that, guess what? What did you do when you were born? You learned how to roll over first, stomach to back. I have people do that, because when you're in pain, you've lost how to use the core. You've lost how to use your back muscles to go from stomach to back, back to stomach. And so I show people how to do it one arm at a time, one leg at a time.
Yes.
And then from there, you got to go like on all fours. So that's like I try to retrain these movement patterns on those primitive patterns. So how does a child learn to run one day? Well, they had to roll first. They had to crawl first. They had to then sit up on their bottom, and they would pull themselves up. So anytime there's an injury, you literally have to go back through those processes. And then, we haven't even talked about breathing, where all that comes into play.
You're kind of blowing my mind here. As a carpenter, you're putting somebody back together. And like everything, it starts with fundamentals that you're describing here. Very, very interesting. So, you don't do much TENS now.
Vibe plate. That's the only other therapy that I really use in my office is a vibe plate.
Vibe plate. Now, I met one of the developers of that up in Chicago. I'm forgetting, his name will come to me.
Yeah.
So All right, so
vibe-
that counts as physical manipulation. So tell me about this vibration plate. We have one in the gym I go to. It's called a power plate.
Yeah.
A vibrating surface,
so
very powerful.
They've done research to show that, there's a certain hertz level. I think ours is like at 30 hertz per second. But the idea is to increase circulation and mainly influence proprioception. So that vibratory aspect can massively influence retraining proprioception. And proprioception, just to make it easy, is joint awareness. So it's like your brain can perceive where joints are at, aligned, misaligned, and they're going to make a response to that. So if there's a misalignment, people always go, how do you know so quick where to find where somebody needs an adjustment? Well, when you're out of alignment, you now have short circuitry in that proprioceptive aspect. Those mechanoreceptors are now sending misinformation to the brain, and so then there's this tonal change.
Yeah, and doesn't the bone, when the bone vibrates, doesn't it release piezoelectrical energy, which stimulates healing and all kinds of other incredible things?
Oh yeah.
Yeah, I found his name, Jason Conviser, a PhD. He's up in Chicago. Give him a shout out. It was really funny. I had seen him for therapy a number of years ago when I was in Chicago, and I saw the power plate at the gym, and I texted Jason, "There's a power plate here." He goes, "Yeah, I'm on the board of directors." I know something about this. Now, when it comes to functional movement, do you know anything about the Alexander technique or Moshe Feldenkrais? Any of their?
Yeah.
Obviously, you've heard about that. Is any of that type of stuff
I definitely
come
think
into
there's
your
some validity
world?
there. I personally have not, studied Feldenkrais enough to like implement some of that. I probably do kind of indirectly, just understanding the somatic and the visceral response, that if an organ is under stress, there's neurology that will send a message back to the spinal cord, to the brain, and then the body will make a reaction. There can be muscle splinting. We've talked about this. I remember early on in your care when I started poking and prodding around in the gut.
We're going to get to that.
So we can make those connections in the next episode in that regard.
Yeah. So what are the roles of heat and cold, please?
Yeah.
Some people say, "Oh, you should heat that, or you should cold that," or "No, you should have chilled it rather than heat it." Can you give me some idea? Do you use hot and cold in your world? And when heat. Should you use one? Would you please help me?
Yeah. Well, I don't know if I'm an expert on that, but
what you must know something. You're soft
encourage people to use heat. Just the research seems to be showing that whole idea of RICE, rest, ice, compression, elevation, is somewhat having a negative effect on the proper healing that should be taking place.
Yeah, because I always said after I hit the weights, I hit the hot tub. It just seems right.
Now that technology's changed, I try to encourage patients to come in and use the soft wave therapy.
We will get to that. That's a directed ultrasound that creates micro stimulation or whatnot, focus for healing. We'll go deeper into that. So as far as just the pure manipulation part of chiropractic, is there anything else that I have missed out that you want to go into that'll help our audience who may be seeing chiropractors, might be considering going to one? Well, maybe you could tell me eventually, how would one choose a chiropractor? We're in Missouri.
Yeah.
Let's say I've got somebody in Maine. I'm trying to think of somebody that's as far away as possible.
Well, for a long time, they would, people would want to know where they graduated. If they were a Palmer graduate, they knew that there was a set standard of techniques that you knew you were going to get adjusted, and you were going to get adjusted well. So if you want to go that route, you can look up somebody and see if they're a Palmer Davenport graduate.
Is that the Mecca of training?
That would it was
Mayo
the first
Clinic
chiropractic school.
It was Palmer.
Yeah, it was Palmer.
Didi and his son was JB. Or
Yep,
BJ.
and then BJ. And
BJ
then
was his
I
son.
believe it was Daniel after that, and then there was Mabel.
Okay.
So, yeah, the long history. I mean, primarily, you're just going to have to, look on the internet,
Okay.
look at the reviews, and unfortunately, you may try something you don't like it. And so
Okay.
you may have to ask around. And, I'm very biased. Like, I'm going to always push individuals from just a sheer adjustment standpoint.
Okay.
I would seek out an upper cervical chiropractor. So you can go to like upcspine.com.
Okay.
You can find any upper cervical chiropractor. There's probably 5 to 7 different methods at which the chiropractor is going to apply that upper cervical adjustment. That's always my first go-to. I love the Gonstead technique as well. It's a little more, you're going to feel it.
Okay.
So, if you want something a little more light, you just have to do your homework. There's a lot of techniques that are a little more gentle. But if any of them are practiced appropriately, nobody should have any fear getting adjustments. Again, unfortunately, we got doofuses in our profession.
Doofus. I love that word.
Screw
That's nice.
You
So
know, but
we've got these cell phone, these smartphones where we
Yeah.
get 96% of our information anyway.
And I mean, for the public, what I don't know if I'm going to beg, I'm going to plead.
Make your
Like-
case. I'll make your case.
Like I want, hopefully, for this to dispel the myths that chiropractic is dangerous.
Oh yeah, the number. I did look up the numbers. I mean, it's one per million. I mean, you're going to get injured
Here's how
stepping
we
off
can
a curb.
solve this real quick.
Help me.
What do you pay in malpractice insurance?
Right.
every year versus
Right.
me? I have 1 million,
Right.
3 million coverage, and I think it costs me like $1,200.
Right.
So see, there's no danger in getting a proper adjustment.
Right, not any more than anything else should be.
And
is
it's just trying that perspective, I mean, it's just, and you can correct me if I'm wrong, the statistics have changed a little bit, but if people just looked at how many people die every year from medications with the right intent, like this is with good intent.
Every
Like,
ad
they're
you see on TV, half the ad is all the horrible complications.
200, 300,000 deaths a year.
Right, there's
Like,
an
can you imagine
accepted-
if my profession was
Right.
killing
Right.
200,000 people a
Right.
year from adjustments? I'd be like,
Right.
no.
Yeah, so relatively speaking,
So number
very low risk.
one, let's stop basing your need for chiropractic care on pain. So my question is, do you want
Love
to
it.
maximize your ability to perform and do life? Yes or no? Yes.
Yes.
Okay, you need chiropractic.
Okay.
That's like basically saying, I'm going to buy a car. I don't really need to do tune-ups. I don't need to do maintenance. It should be fine. Because once I go to the mechanic, now he's going to want an oil change every freaking 3,000 miles. He's going to want me to rotate my tires. I was like,
As you
why
ought.
is that bad?
As you ought to.
Because what does that do? That provides maximum performance for that vehicle. And so I want maximum performance for my life. It's like I'm getting ready to turn 49 here in May.
Okay.
I got 50 more years more than likely.
God willing.
Yeah. So like I'm not going to wait because I've already done my time in pain. The early 30s sucked for me. It was miserable. I had a herniated disc. I had shoulder pain. I couldn't sleep more than 3 or 4 hours without, waking up,
And you've benefited from chiropractic in your own life.
Oh, I started when I was 13.
Oh, wow.
So maybe we should tell that story now.
Well, tell me about that. I would love to hear. Tell me about 13-year-old Jeremy. Did you have an injury or something? Or
No,
pain?
actually, my parents, were dealing with some back pain. And we were living in Northern California at the time, in Pleasanton, California. And my parents started getting adjusted. And so the chiropractor was like, hey, you got kids? He said, yep. Well, you should bring them, and here's why. So my brother and I were avid, athletes. I mean, big into soccer.
Okay.
And so here I am, 13 years old, played soccer since I was 7. Absolutely, my love of sports was soccer.
Okay.
And I just found myself realizing even at that age, like, I'm back at the field, lickety split. Even if I had a minor ache or a pain, it was just like, I don't know, I put it together at 13, like I was performing at a higher level every time I came in to get an adjustment. Then I just was fascinated by his charts in there. And I remember telling him, and when I was 13 years old, I was like, I think I'm going to be a chiropractor. Because this guy was the chiropractor for the local high school football team, and I thought that's what I wanted to do.
Yeah.
And his name was Dr. Stephen Hickey. And
Stephen Hickey.
And he said, well, if you're going to be a chiropractor, then you're going to Davenport, Iowa. If you're going to call yourself a Palmer grad, you're going to Davenport, Iowa. He's like, I don't care if there's one in San Jose right here, 20 miles from us. He's like, you're going to Davenport, and that's what I did.
So you knew early on you had a fascination with it. Now, did you have pain, any particular treatments or injuries?
I don't remember. Well, I think I was 13 when I pulled a groin really bad, but I don't remember, chiropractic, having some miraculous. I mean, you pull a groin. I mean, you got to rehab it. But I didn't really experience, my first real pain till I was in chiropractic school when I still played soccer and got hit from behind and suffered a pretty, devastating blow that locked me up pretty bad. Numbness and tingling. Spent months trying to even getting adjusted, and finally, in a clinic abroad trip, so I was through all of my requirements to graduate. So then that qualified me to go do more abroad. So we went to Fiji for like 11 days. We set up a free clinic over there, and lo and behold, a student is who finally fixed me. It was like this knee chest adjustment, man. It was just like a bomb went off in there, and it was just like, oh, thank God, I love you.
Right.
So it was like I was free of pain for quite some time, but then it just like that window of pain free kept getting smaller and smaller and smaller until I think we were on our fourth kid. I was in my early 30s, and I remember it was probably 8 months that I went in, had an MRI, had extruded C6, C7 disc. It was bad. And I had unrelenting softball size pain in my left shoulder. Hit it. I mean, my patients didn't really know.
Or you soldier on.
It was bad.
Right.
And so that's really what started my journey into looking beyond just getting adjusted.
So let me what happened to that? Is that a herniated disc?
Oh, yeah.
What happened to that herniated disc?
It went away.
Without surgery?
Yep. It was pretty cool. I remember looking at the MRI.
You're not just saying that.
I'm not just saying that. When I was 30, I think it was 35 when I finally got my first MRI. And they pulled it up, and I was like, that's not me. They're like, no, it is. I'm like, but that looks like a 60-something-year-old neck. I mean, you could see the degenerative arthritis. You could see, I mean, that sucker was extruded into the nerve root canal.
What did you do?
Well,
will that be the second half of our talk?
It could be the second half of their talk, but I can say I have not had surgery. I did not get a cortisone shot. I was that close to getting it done.
Didn't even get a shot.
And my wife finally convinced me to change something with my diet.
Oh, what a perfect cliffhanger for it. So you're gonna have to tune in for episode 2.
Episode 2, because we're gonna help our viewers see the connection to food, body, spine, holding adjustments. It will literally blow your mind.
Oh, that's perfect. So I'm going to summarize this. Chiropractic by a competent person who's not just cracking the entire spine, but is finding focal, specific issues and addressing them precisely. Is effective, and it is not dangerous.
Correct.
And it doesn't have to be 2 or 3 times a week. These things will heal. You can come up with a regimen for maintenance. Somebody who mixes all these things together like you do can come up with something like that. And pain is not the only thing we're looking at. We're looking at function and lots of other things. Yeah. However, it's pain that's usually the motivator that gets someone in your door.
I don't know who said it, but nobody really does anything out of motivation. It's always out of desperation.
Out of desperation.
And so, as we kind of left people hanging here at the end, if you really want to find the best way to do chiropractic, what now you're going to do is you're going to look for the nearest wellness way clinic near you.
And we will be putting some links to
Yeah.
Jeremy's practice in the description below. Well, thank you so much. I've learned so much about basic chiropractic with you today. I really appreciate you taking time to
Oh,
come
you bet.
talk with us. I look forward to another discussion very soon
Yes.
about these other things that affect health and wellness that you fold into your type of chiropractic practice.
You bet.
What a pleasure
Thank you.
talking to you. Thank you so much.
My pleasure.